Hi guys, Dr. Garda here with part 1 of our series on surgery versus chiropractic. And God knows that if you are going through a pain crisis, right, and you are in pain and you don't know the best course of action because you want to get out of pain, you want to get your life back, at that point it can be hard to advocate for yourself. So, more and more these days, surgery should be considered your last resort, for the treatment of neck pain or back pain problems, because the risks are significant. The cost is high and it's a long recovery. And if you're not finding relief with physical therapy or injections or meds, you might think surgery is next on the list. So I want you to follow along this week and share with a friend if this resonates with you, because new research has really shown that chiropractic care should be considered first. And the results may surprise you. We'll see you in part 2. Part 2 of our series, surgery versus chiropractic. Now, you may not have heard that the failure rate for a spinal disc surgery is up to 20%. And to make things worse, the next step after that is, after a failed discectomy, is typically more a dangerous spinal fusion. So before exploring surgical options, we really want to encourage you to advocate for yourself and to consider chiropractic care. In fact, researchers have found that patients who have previously failed with therapy and medication found just as much relief with chiropractic care as they did with surgery. And that's avoiding all of those risks. So that's good news, right? And we'll see you in part surgery versus chiropractic, part 3. Okay, so it shouldn't be a surprise at this point that the majority of patients who can't find relief with physical therapy or medications, they've experienced benefits with chiropractic care. We've previously, last week, I think we discovered failed back surgery syndrome. Now, check this out. There are studies out there now showing that chiropractic care can help people even after their surgery has failed them. We've seen this in practice all the time. So if you go along, you can follow along in our blog on the website, and you can click those links and see for yourself. More miracles tomorrow in part 4. Part 4, surgery versus chiropractic. Now I'm going to make a bold statement. Many more times than you might think, people can benefit from chiropractic just as much as if they underwent surgery for the same problem, and that's without any of the risks, right? So we have another study which concluded that for spine, hip, and shoulder pain patients who had clinically similar pain relief and greater satisfaction levels and lower overall costs if they initiated care with DCs, chiropractors, compared to the MDs, the medical doctors. So people with the same problem, one goes to the chiropractor, same problem goes to the MD, and the chiropractors, they have a better, safer, and less expensive solution. So we have links on the blog that you can follow along, and we'll see you in part 5. Okay, home stretch, part 5, surgery versus chiropractic. Okay, so the science is really starting to back up, what chiropractors have been saying for years, before the medications or the injections or the surgery. Chiropractic care might be your smartest choice because, we work with your whole body to help reduce the pain associated with, spinal disc issues, for your back or your neck. We reduce inflammation, we improve your spinal motion and reduce the compression of your spinal nerves, right? So chiropractic helps get you well without any of the risks or the dangers associated with drugs, or injections or surgeries. But if you've been following along, on our blog or on our Facebook or Instagram, you already know that. So we'll see you next week. All right, thanks guys.